we're about to do a dry needling technique for iliacus. Now, we all know that the iliacus muscle is that part of the body that nobody likes having treated with manual therapy because it's so uncomfortable. It might be effective, but it hurts. So we're going to use dry needling instead to hopefully access that muscle with a lot less discomfort and hopefully just as good an outcome. Alright, so first of all, we're going to prepare the skin with an alcohol swab, as we always do, following our hygiene procedures, identifying the ASIS, the iliac crest, the highest point of that iliac crest. So those 2 points there give us our landmarks to work in between. Anywhere between those 2 landmarks, we can angle our needle back towards the ilium and safely affect that muscle. The key things for this are that we don't want to go too shallow. If we go too shallow with our approach back towards the ilium, we end up approaching that ilium right at the very top with the needle. We're going to miss the muscle at the top. It starts a little back from the edge of the ilium itself. At the same time, we don't want to go too deep for obvious reasons. We've got the abdominal contents down there. So the angle is quite important. We're going to look at that now as we insert the needle. I like to use a 50mm needle with this one, placing your fingers of your other hand along the edge of the ilium to get a sense of where that is. I can drop over the edge so you can see that's the anterior surface down there. Coming back a few centimeters away from that, and we're going to point the needle at an oblique angle, not too shallow, but also not perpendicular down into the skin, angling into that anterior surface. A lot of people worry about getting too close to the organs of this one. We also have to think about the fact that we're going to have skin, adipose tissue, and then multiple layers, the obliques, the transverse abdominis to go through. So there's quite a bit of muscle and quite a bit of depth to play with. But at the same time, obviously, having a more acute angle going down like that is going to be a dangerous approach. So coming down through here, angling towards the ilium. In some cases, you'll hit that bone, which the patient won't be bothered with at all. They won't even feel that. But you should feel a thickness of tissue as you approach the iliacus, and often they'll get that deep internal kind of ache through the pelvis with that one. Now, if you've got a patient with quite a large belly, if there's a lot of adipose tissue, the trick with this obviously is that you need to have the patient laying on their side, and the belly will shift across and create this little sulcus that you can see here that allows us to very safely access the anterior surface of that ilium. Too much belly fat here will lift this up and it'll make that angle very difficult to come at with the needle. So if that's an issue, simply lay the patient aside and you'll just change your approach and angle up into the ilium from there. Okay, that's our needling approach for iliacus.